grandparents, parents, aunts, uncles. I'm surrounded by cardiovascular disease. So I really went to medical school to treat cardiovascular disease. Despite my best efforts, I have cardiovascular disease. A little over 2 years ago, because I had a sudden death arrest while I was on a treadmill. Ended up having an operation on Grand Cayman as a result of that, and fortunately I've done great since.
He's very unique because he's always upbeat, no matter what's going on in the OR, going on in the office, going on in his personal life. You'd never know that something was going on. He is always upbeat.
His patient satisfaction scores are just through the roof. And when he knocks on the door, I hear him go into the room. It's like he's seeing a long-lost friend, and he's just so outgoing and personable and, caring that the patients just love him.
What's special about Leon is if you talk to him about his patients, not only does he know his actual patients, he knows their whole family. He knows which college he went, where he worked. He treats it the way medicine should be treated. He treats the patient as a whole, not as a disease.
In the time that I've worked with Dr. Josephs, we've had to have some challenging conversations about care and what's best for patients, but we always end up in that same place about what is it that we want to be and who do we want to be as an organization and as caregivers and administrators helping to take care of patients, and Leon is 5-star in all ways, making sure that we do the very best for them.
What I do like to talk to my patients about is how you have to do everything you can to prevent cardiovascular disease, because despite our best efforts, people have it. And I try to talk to them about managing the things they can control, right? You can't control your genetics, but today you can control the known risk factors. And that's where I spend a lot of time talking to patients about the role of cigarette smoking in cardiovascular disease, the role of diet and exercise in both the cause and the prevention.
Not only is he kind and generous when he's out there in the world, but behind the scenes, there's always a positivity to him and a willingness to help others.
Dr. Josephs is incredibly important to St. Vincent Hospital, and I'm really proud and honored to say not only is he a great recipient of this award, but he's been a great friend to me.
Leon has led the organization through very difficult times, and we're in the place where we are now because of Dr. Josephs. He's done a tremendous job at Reliant Medical Group. He's been a wonderful person to work with. He's a leader. He's a great role model. He's been a great mentor for me. As the chair of medical specialties, I work closely with Leon. I can't think of a more deserving candidate and honoree for the American Heart Association. So congratulations to Dr. Josephs.
If you see what I've seen and suffered what I've suffered, both personally and as a professional and in my family, it's kind of hard to ignore the Heart Association, because so much of what we know today or learn today or can do today is based on it. I also have a family full of educators, and the idea that the Heart Association is out in front of schools, educating students and college students and high school students, and in industry teaching people working in manufacturing and in warehouses what they can do, both for themselves and to help a fallen colleague, is really important to me.
We are really blessed to have him here. I was very blessed to have him here, personally. So to me, he was like a big brother. So of course, if anybody deserves it, he deserves it, because he truly has a heart of gold.